to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday, keep your appointment with Dr. Donna. Hey. Good evening, everybody. Welcome to an episode of Talking with Dr. Donna. Thank you so much for keeping your appointment tonight. And remember, you have an appointment with the doctor every Thursday at 6:30 p.m. You can follow me on Instagram, on Facebook, and if you're not already a subscriber, go on over to YouTube, to my YouTube channel, Talking with Dr. Donna. Hit that big red subscribe button and then that bell icon right next to it so that every time I go live, you get an alert, okay? Remember, our mission here is to build a generational health network. And our mission is to end the cycle of premature deaths in the Black communities in America and across the diaspora. And we do that by focusing on 4 pillars of health. We focus in on our physical pillar of health. We focus on our emotional and mental health. We focus on our spiritual health, and that is not at all religious based, but that is the basic understanding there's a higher power. And we know that when studies show that if the belief in a higher power aids in your healing and in your health. So we have a pillar of spiritual health where we talk about spirituality. And of course, environmental health. And sometimes we don't pay attention to our environment. But the health of our environment, the soil in which we grow our food in, the air in which we breathe, all of these things, the water that we drink, all of these things have an impact on our health. So we focus in on these 4 pillars of health because we want to build generational health. When we talk about generational health, we talk about it because I want you to understand how important it is to start thinking about your health as a child, not waiting until you're in your 30s or your 40s, until you're diagnosed with your first illness, that you start thinking about health. But we want to build it from the beginning. So for our children, we start talking to our children about health from a very young age. So they recognize these 4 pillars and they start to incorporate those 4 pillars into their everyday life. Because in my family, generationally, we have a whole pathway of high blood pressure, that's on my side. And then we have a pathway of diabetes, which is on my husband's side. And I would prefer that neither one of my children are on that same trajectory, that same path, so that we are going to change our generation. And studies show that if you make a small change, just a small change right now in this generation, that you can impact the health of the next 4 generations. Can you believe that? Are you hearing me? So when you teach your children how to live healthy lives from the beginning, you are impacting their health generationally. And that is our goal on this show. So thank you for tuning in. We have a great show tonight. I'm excited to talk about diabetes. But before we do that, I want to give recognition and homage that this is Indigenous Heritage Month. And you can see I have on one of my indigenous pieces because in my family, my father is from Oklahoma and we have a lot of Choctaw Indians and in our family. I know y'all like, yeah, that's right. I said Choctaw, not Cherokee. So I let y'all know I know what I'm talking about, right? So we want to pay homage to Indigenous Heritage Month. And if you have seen Black Panther, you will understand that there are people who have been and on this earth prior to the colonization of the Americas. And so we want to pay homage and tribute to them this month. Now, November is also Diabetes Awareness Month, and that's part of the reason why we're talking about diabetes tonight. It is one of those diseases that we hear about all the time, and it may not be called diabetes in your family. It may have been called the sugar in your family, or I may just have high sugar in your family, but it is diabetes. And so it's important to understand, again, back to our generational health network, it's important to understand generationally what's in your family, right? What is in your genes so that you know what to be aware of, what to pay attention to, so that you don't go down that same path. So as we talk about diabetes, there's just some facts that I want to give you so that you understand why this disease is so important for us to talk about and for you to get information about and to understand. So there's about 37.3 million adults who have diabetes in the United States. That's about 11% of the US population. And to put that into perspective, African Americans, we only make up about 12% of the US population. So the same number of Black people across this country is about the same number of folks who have diabetes. That's a lot of people. And of the people who have diabetes, 1 out of every 5 people don't even know that they have it. And that is scary. And we're going to talk about what are some of the symptoms so that you can recognize when you have diabetes. Now, about another 1.5 million people are going to be diagnosed with diabetes this year. That's a lot of people who are going to get a new diagnosis of this disease. And it's important that you know and understand about this disease. In the last 20 years, the amount of adults that have been diagnosed with diabetes has more than doubled. And that's because of some of the risk factors that we're going to talk about tonight that puts you at risk for diabetes. And we know obesity being one of them, and the epidemic of obesity in this country has caused an increase in the number of diabetics across this country. It's the 7th leading cause of death in the United States. Diabetes and the complications associated with diabetes, 7th leading cause of death. And it's the number 1 cause of kidney failure, of lower limb amputations. That means that we're cutting off, feet, knee, right below the knee. We're cutting off those leg bones. The number 1 cause is diabetes. And it's the number 1 cause of adult blindness. And that is important to recognize because like I said, in my family, we have high blood pressure on my side, but my maternal grandmother, so my mom's mom, actually had diabetes. And the way that she found out she had diabetes is that she was getting on a bus to come from Louisiana to California. And as she got on the bus, her vision was a little blurry, but she didn't think anything of it. By the time she made the trek from from Louisiana to California, and she got off of the bus, and her vision, she had gone blind, and the cause was diabetes. So again, 1 out of every 5 people may not even know that they have diabetes. So let's talk about that tonight. Tonight, I have a specialist, and the specialists who deal with diabetes are called endocrinologists because it deals with the endocrine organs of our bodies, and that's where all of the things like diabetes and cardiometabolic syndrome, which we're going to talk a little bit more about tonight, that's where it all comes from. So I want to introduce my friend and our guest tonight, Dr. Carl Finley, MD, MBA, who is an endocrinologist. He's a native of Southern California and graduated from the UCLA School of Medicine. Yes, Dr. Finley is my medical school classmate. He went on to complete his internship and residency in internal medicine and primary care at George Washington School of Medicine in Washington, D.C. He completed further training at the National Institutes of Health, or NIH, you may know that name, and completing a clinical and research fellowship in endocrinology, diabetes, and metabolism. His research focused on diabetes and insulin resistance in the Black population, and it has been presented at the American Diabetes Association's annual meetings and published in some peer-reviewed journals. So, my friends ain't no joke. I hope you should know that by now, but Dr. Finley is no joke. He relocated in 2007 and realizing that he wanted to make a larger impact on diabetes and obesity and high blood pressure. So he began a consulting career. And in 2014, he continued his healthcare consulting, moved out of DC, moved into a little bit of warmer area in Texas, and he continues to do consulting work with healthcare advocacy groups and government entities to advance public health policy. I talk about this all the time. It's important that we have folks like us in these positions to talk about policy, to make sure, because they're advocating on your behalf. He is married and has a daughter who just recently went to college. So he's an empty nester, and he resides in Dallas and enjoys the food and the culture of the city. So let's bring in and give a Talking with Dr. Donna welcome to my friend, Dr. Carl Finley. Welcome to Talking with Dr. Donna.
Glad to be here.
Thank you. I won't tell them your medical school nickname.
It's okay. It's okay. We're amongst friends.
Yes, we had a great medical school nickname for Carl. We called him Big Papa. That was his nickname. Many nights studying late with Big Papa. So, Dr. Carl, let's talk about diabetes. Tell me, what is diabetes?
So first of all, thank you very much for having me. And wanted to just maybe start off with a little bit of terminology and about diabetes. And we talk about maybe some of the things that maybe happen from it, where they demonstrated that, it's the number one reason for what I always like to say when I talk in the community, and even talk amongst peers, is that it's not diabetes that's causing those uncontrolled high blood sugar. So therefore, the mindset is not just because these things happen, it's when we're not controlling it, and that gets there. So just one to put out. So what is diabetes? So diabetes is essentially a disease, but it is a condition where your body, which normally keeps your blood sugar, and blood sugar is important. It's what provides energy for our body to do what we need to do in a range, which we consider normal. Okay, and there's no fluctuations up we see. So normally that occurs when you have diabetes. You have the inability you get a lot of fluctuations, and the end result is some of the higher blood sugar is what that we'll talk
about. Okay, so that's really an important distinction that you made, that the issues are not necessarily that you have the disease, but that the disease is not controlled. And that is a really good distinction for us to make.
Absolutely.
Yes. So there's a couple of different types of diabetes, right? So can we go through the types of diabetes and maybe what's the difference in their causes of the types?
Absolutely. So in the intro, you talked about the number of diabetes. And so I think for the most part, everyone's heard on the surface type 1 and type 2 diabetes. So we'll start with type 1, in order. Type 1 diabetes is the lesser type, meaning that there's, out of that number of 37 million, to 10% of those people will have type 1 diabetes. And so and if we go through a little bit of anatomy, is that you have an organ in your body called in the center of your tummy. And that secretes a hormone called insulin, which control your blood sugar. So what happens early on, and you may have heard of childhood as you get early on in age, that's usually more so the type 1, where due to a virus or something that causes some type of sickness in your body starts to attack the cells that make insulin in the pancreas. So those are kids that end up in the emergency room with some of the symptoms, peeing, urinating a lot, and they end up with high because their pancreas is no longer making insulin to control their blood sugar. More about 1 out of 10 of the individuals who have died. Now, the one that we're going to probably spend the majority of our time on today are this 2 diabetes. So that's about 9 and 10 or 90% of those folks. And so it's really is a multifactorial type of causes that. And Dr. Donna, you mentioned sort of the pillars of health, psychological, you mentioned environmental, all those things come into play that kind of make the runway for type 2 diabetes. So whether it's us leading a sedentary lifestyle, us having family history of type 2 diabetes. I think you mentioned your husband's side of the family. I can tell you both my sides of the family have it, and I think probably ours as well. Family history. Also, we look at from a dietary standpoint. Again, we'll get into some specifics, but overall, having it can also add to it. The one thing I want to sort of leave around type 2 is that it can be you can type mode, and that is if you optimize a lot of this, the things that we do sort of normal in our life, and so that being there is the ability to kind of change course. Okay, notice I'm not using the word cure. We'll talk about that a little bit as we proceed on, and so that's sort of the main 2 types. Type 2. I will then add on gestational diabetes, which is that comes about during pregnancy, and it's usually because now the mom are demanding more of the pancreas, and the pancreas is already started, and so you start to get blood sugar, elevated blood sugar due to the mom, and once that baby is delivered, usually normal, but it's been said, and we looked at studies over the years, that about 10% chance per year of developing full-blown diabetes after the birth of the child. And when I say that number is exact, guesstimate some of my former patients how old their children were by their new onset 9, 10, and 11 years.
Yeah. And that is amazing. So we got the 3 types of diabetes, the main ones. Type 1, which is your body starts to attack itself for some unknown reason. That's usually with kids. Type 2 diabetes has a lot of risk factors, which we're going to talk about, right? Mostly the adult onset diabetes, and then the gestational diabetes. And so there is another phrase that we hear a lot about diabetes, and that's something called pre-diabetes. Can you talk a little bit about what is pre-diabetes?
Absolutely. And I think that's a great question. So first, because as an individual, along with colleagues of mine in the early, led the charge on changing the phraseology, where folks would say, oh, you have a little bit of diabetes, or you have touch your sugar, or whatever the case may be. I think what it led people to think was have it. And so you had a lot of folks go on to think, okay, well, I'm not quite sure, and so therefore I'm not going to concern myself with it. So we pushed and to have this name of pre-diabetes, because in the mind lets people know I'm on the road toward diabetes, and therefore I to sort of to change that course. So pre-diabetes is a definition that we get from lab work, and what it is again, as we think about from two diabetes, their pancreas can, let's just say, not be working at 100, start slowing down and be at 90%. And albeit living your life normal, that 90% can cover what you need from the standpoint. But if, for instance, if we stress your body out with a high carbohydrate load, what we would see is that pancreas would filter out, and you would see some of that blood sugar remain high for a longer, and it may stay high for 2 days and then come down. And just that starts to have negative effects on your body. So we call that pre-diabetes, and there's a lab test of which you can get to help put you and understand diabetes standpoint. And if I would add just one thing, there was a fact that 5 individuals don't know they have diabetes. Usually those 1 in 5 either have pre-diabetes or have full-blown diabetes. I've actually done those studies where we would reach out on a radio show and say, if you consider yourself healthy, and we're going to put you as part of a database. Well, actually 1 in 4 of those individuals or diabetes, and those are the individuals that also go on to have even more problems, seeing that they have blood sugar problems, and therefore their body is being affected.
Wow. Okay. Thank you for that. Okay. So when you talk about a blood test and screening, so let's say you do have diabetes, or you're pre-diabetic, are there some labs that you should make sure that you have, screenings for at your regular exam, your regular physicals with your doctor? Like, what kind of labs and testing should people really be paying attention to and making sure it's done for them in their annual physicals?
Well, that's a great question. So let's just take a step back, and this is for individuals who are regular updated physicals, which are yearly. Okay, so a simple test is a simple blood test. We can measure your blood sugar. Now, blood sugar is dynamic. So what we typically ask and request is that we do a fasting blood sugar level. You have not eaten anything after the midnight from the previous night, and we can get that. That gives us a number range. So typically, that blood sugar should be milligrams per deciliter. Okay. Now, if we get that number 100 and 125, that is pre-diabetes. If we get that number and it's above 125, then that is a diagnosis diabetes standpoint. Now, the thing is, I said this is a dynamic movement, so you can test that number. It could be normal, but it doesn't necessarily tell us time. So we can do another test that's called an A1C. It stands for it's hemoglobin, and essentially what that is the sugar in your blood, but it will settle on your hemoglobin molecules like a dust on a table. So if you have a house, it will settle on your tables, and we can measure that sort of level of dust, how much dust or how much blood sugar you have floating around. And that's an average over time. So we'll get one blood sugar number and an A1C, which is also a blood sugar test, and that tells us where we are in terms of blood sugar in a pre-diabetes state or in.
Okay, I love that because, so often people will come to me and they'll say, oh, I took my hemoglobin A1C and it was high, but I ate a piece in, or I had some rice before I went in, and that's why that number is so high. But tell us why that's a falsehood on the hemoglobin A1C. You started explaining it, but how long of a period of time is that test looking back? It's not just when you ate that piece of cake before you went into the lab test, right?
Absolutely. ABC doesn't lie. It is a test that gives us an average of your blood flows. So if you had a peak on day one, you had a day 8, we're still talking about 88 more days that's 88. So yeah, I mean, the whole goal though is go in and get these tests. The goal is not to try to why why it's not, but why is it, and then we can tackle it. One of the challenges in health. I mean, nobody wants to be diagnosed with anything. I understand. We sort of understand where we are, understand the truth. Then we can tackle it, clinician and the patient, because I consider the team approach on what we're going to do going forward.
All right, and I'm so glad you said team. We're going to talk a little bit more about the team a little bit later. So you talked a little bit about some of the symptoms, but can you go through maybe a little bit more of some of the symptoms that of diabetes, and because some of it is not so obvious, right? You may think that it could be a number of things causing it, but taken together, it makes a difference.
Absolutely. So as I talk about this, so that people experience when they have high blood sugar is it is absolutely nothing. So that makes this condition and even more sinister, because what tends to bring us into, I feel something here, I don't feel quite right, and so on and so forth. So it's really not the conversation to be, is that we have to stay current on our physical things we talked about in the previous question, getting our blood test. But barring the not things one might sort of see, we call it the 3 polys area, which is a fancy way of saying you're just going to the bathroom too much. And that doesn't mean getting up to go to the bathroom. We're talking getting up every hour. Okay. Taking over the story. Hey, my husband and I were driving down 95 corridor, and we had to stop at every truck stop. Okay. That's a common diagnosis. Poly. The next poly is what we call polydipsia, and that's a fancy way of thirsty. I'm thirsty all the time, and because you're peeing out a lot, of requesting that we put in a lot of fluid. Unfortunately, we don't put in just water, Coke, and juices, and so we're actually dumping more sugar on top of it, which makes the condition even worse. And then the third poly,
Elwood, please bring the big symptoms up on the screen. There you go. Thank you.
The third poly is polyphagia, which is I just feel hungry, and it's such a subtle thing that and I'll give a little bit of a quick caveat story to this. So you're peeing off calories. You can test your sugar, and you can test your sugar, and urine is sweet. And actually, this has been shown. This goes back to ancient times. Inscriptions in Egypt on the walls showing flies flying around the urine. So that tells us that this is not a condition that, and people recognized it. So you're peeing off a lot of sugar, and what that does, or calories, is weight. So one of the number one things I've heard in my career is that, yes, I went in, I saw I'm a bit high. They told me I need to lose some weight, and guess what? I started losing weight, and I asked anything from the standpoint of trying to lose weight. No, it was just coming off of me. Well, that is a problem within early diabetes, that is sort of unexplained weight loss that can happen here. As we see, blurred vision. I think you mentioned grandma, I think, had
Yeah.
that on a trip. So that's easily sort of clouding the lens in the eyeball, and it can do some more numbness and tingling in your hands and feet. So blood sugar in its does a good thing for the body. It provides cells with energy. But if it's irritating small vessels, the small blood vessels, and so that's when you start in your feet, and that's a prelude to ultimately not being able to feel, lead to other things. We talk about skin sores and then ultimately amputation. How about just feeling fatigued, feeling tired, feeling not like you can do? So we talked about blood sugar being that energy fuel source. Well, essentially, what's outside the house? It's outside of your cells. It's not getting into cells. And the second my tank is full, and so therefore I'm hungry. So that's why you get the sensation you have high. You also feel like you're tired. So the sugars in your body is just not in the right place. About having very dark and dry skin. So this is something that we see a lot of. From a trained eye, I can look at somebody and tell them if diabetes. So this darkening on the crease of the neck or in the underarms is nigrocanes. And again, I like to tell little stories with these. So a book written called Diabesity by a pediatrician, and what she described in the emergency room was a male child of Latin descent, where the mom complained not taking a shower and not scrubbing their skin. And so she had scrubbed his because he had darkening of the skin. He had this acanthosis nigricans, which turned pre-diabetes and not a sign of dirt. So the very dry skin that can occur. Having sores on the heel, that the numbness and tingling, it's on that spectrum of not being able to feel, and then all of a sudden walk around with a tack in the bottom of your foot, which then gets infected and can. You can also just heal slowly. So even a scratch heals slowly because the blood sugar is healing quickly. And then lastly, again, your body's not quite right, and you tend to have longer hold. You get a viral illness, and instead of getting better in 2 days, it's taking 4 days. So you're not quite working in tip-top shape. So those are the sort of the symptoms, but just keep in mind the number one symptom is not feeling anything at all.
All right. Well, thank you for going through those symptoms. And a lot of those symptoms are so subtle that you may not even you may not be able to pay attention to it, right? You may think, like you said, you're losing weight. You're like, oh, hey, I'm losing weight. But if you're not doing anything to really be losing that weight, that should be a signal that maybe there's something else going on. If you're not actively exercising or dieting or doing something that makes your weight drop off, but yet you're losing lots of weight, that can be a sign. So just want you out there to just kind of pay attention to yourselves and to your body. There's something along with diabetes that we hear and people may have heard, and that's something called the cardiometabolic syndrome. And it's confusing. It's a lot of big words, big phrases, but really, what does it mean and why do we even care about it? What is so important about this cardiometabolic syndrome?
I will tell you, the cardiometabolic syndrome is the number one thing in business. And we talk about the cardiometabolic patient, we call it shared patient, because what happens is this is overall a condition whereby it includes a number of different, may be covered by different specialties. And so you can imagine having a number of only treating this part, only treating this part. And so it actually are looking at doing cardiometabolic centers so that one eventually be in one place and be cared for by a number of different definitions. This is a great picture here. So there's actually an official definition where there are 5 conditions in which we look at. And to be diagnosed as having cardiac, you need to have 3 of the 5 of these conditions. So let's start with triglycerides. So triglycerides are just one type of fat that we see in measuring our lipid panel. And so triglycerides above 150 would be want to see that the body or that the individual is less than. Now, if we just move, we're going to see low HDL cholesterol. Now, you may have heard of the good cholesterol, or HDL is the good cholesterol. So if you have low HDL, that's not a goal. We look at, for men, it's above, for women above 40 that we look for. And that actually can phase risk or a good thing when we talk about the cardiometabolic syndrome. So then at 12 o'clock is visceral obesity. Visceral type of weight we carry along our midsection. Sometimes we call it the parachute body habitus. And again, it's that weight around the midsection and around the buttock. So an official number that we look at for that as well. So we look at waist circumferences for men are going to be a little differences of women. And so for men, a waist circumference of 40 inches considered having a positive visceral obesity section. And then for women, 35. So really talking about good size there. So then if we keep moving, it's insulin resistance. This is essentially where I did my research, but it's sort of synonymous with what we talked about earlier. It's sort of that if we look at the spectrum of starting off having normal blood sugar to having diagnosis of diabetes, that somewhere along those lines that either working a little bit slower or the insulin that is producing is not actually functioning properly. We call that insulin resistance. And that can be measured through talked about earlier. And then the last one here is high blood pressure. And that's another syndrome that much more significant. And that's got low 130 over 80. So 130 is the top number, 80 is the bottom number. Now, this often folks can come into their doctor's office with blood pressure that's a little bit higher than that. Let's just say 140, 150 over 90. And we do run to your doctor's office after we've made you wait for quite a bit of time. You can be a little anxious. And so we understand there's a thing called white coat syndrome. He's going to tell me, and so on and so forth. So this is something you can take an active role on if you roll. If you go to CVS or Walgreens or whatever your local Walmart is, you can actually buy a mobile blood pressure cuff and measure your blood pressures on different times of the day. So bring that data in to your doctor's office so that there's a sort of a collaborative team approach to blood pressure. Because too often, and I've seen this, I've done for law firms, and I've seen blood pressure patients said they just had some fries, or they have white coat high blood pressure. As that goes on for a long period of time, and the body is still experiencing high blood pressure, which can go to its effects. So just be a partner in your care, and you can help assist in the discussion around what should be done for to
All right. Thank you so much for explaining that, because we hear people might have heard that term and not understanding what it means and why it's important. And so recognizing out of the
Mhm.
5 symptoms, right, 5 things, if you have 3 of those, then you're at an increased risk for what? What does that mean if I have 3 of these 5? What does that mean for me and my health?
Right. So what that puts you in at risk for is cardiovascular, umbrella term for saying uh, potentially having a heart attack, stroke, or having what we call peripheral artery disease, which is essentially having a heart. And so you may be out walking one day and your legs sort of just have pain as you walk. So as you see here, these conditions, so heart disease, and heart disease is not just heart, but it's heart and stroke, as we still put you at increased risk for type 2 diabetes. And all of these put you at increased where, an early demise. And we want, as Dr. Donna said, we're trying to change our health. And this is one of the things that takes a big step forward.
Awesome. So we talked a lot about what is diabetes, what are the symptoms of diabetes. Now let's talk about what we can do if you're diagnosed with diabetes. What are some of the things that you can do to help control the diabetes, right? Because that's what's important about preventing complications, is the control of the diabetes. So what can people do to control their diabetes?
Well, I would say the first thing, and you're going to hear this probably the third time I say it, is in your care. So I understand, and one of the things, clinician, I built a practice in DC around this. I understand it's scary to be into automatically think about maybe a family member who had was not the best around diabetes, but become an active partner in it head on, and also find a clinician that you can communicate with, that you can work through this condition with. If you have somebody who's speaking to you, you don't quite feel like they have the best interest, it's okay to look and ask for who's going to be the best advocate for you. So what can we do? So I went from just becoming very, very educated. I mean, one of the things we did at the diabetes center that was, in addition to being diagnosed, we actually put people in a around other people who were newly diagnosed. So the first thing was realizing that this is not unique to you. There are a number of people. We said 1.5 million per year. There are a lot. So becoming educated, becoming taking it on head on, and I don't have Facebook relationship with my old patients. I'm happy to see on to become diabetes advocates with American Diabetes Association, and because these are people who walked in who, they were just looking down about what they've been through and where they are. Okay, so I would say those are the first things. Before we jump into medications, the key is, after learning the bull by horns, is thinking about lifestyle. And I think we tend to changes, recommendations. Some of the clinicians make recommendations that are wholesale in America. That's absolutely not it. Okay, I want you to become a vegan. Absolutely not. Start making small incremental changes. So it's been shown that if 1% of their body weight, so that means if they weigh 200 pounds, if they lose 10, um, that actually makes a big difference in the research. And if one starts to make small changes in their diet, so that means their soda intake to 50% or down by 50%, down to 75%, doubling the amount of water intake, cutting down on the processed food. So anything tear open that makes a big noise, probably limit those out of your diet. toward things that are closer to the earth. So that means the vegetables that we're things, try to add one of those a day to your meal. Try to lean meats, okay, instead of the fatty meats that we typically. So if we're making sandwiches for lunch during the day, instead of using a processed meat like salami or turkey breast that comes out of a package, which, by the way, you just taking the leftover chicken that you cooked last night, slicing off a little bit of the breast for a sandwich, using whole grains, and also staying away from those fats, which are in butter and oils and so on and so forth. So having those type of diet, I'm not a nutritionist, but I work closely with them, and we sort of what does the individual like, and how can we make slight changes around that. We talk about weight, diet, and then just being active. Now, we turn our sights toward, and maybe I'll add, looking at and being the web around American Diabetes Association, which has volumes of information, well thought out and well put, and then an association that I'm part of, the American Endocrinologies, all have great resources to sort of put in your coffer. Now, there are also medications, and I would say medications don't change, and lifestyle changes, if done effectively and early, can the blood sugar and can put it in a normal level, but usually they're done in conjunction. So what's interesting about diabetes has come a long way. I finished training 1,000 and practiced for about 15 years before I started full-time consulting. But the newer medication sort of changed the game. It was no longer, we're going to give you some insulin, which coincidentally did a great job on your blood sugar. But what it did was to add a little bit of weight. And that adding of weight was not insulin. It's sort of just what happens with the body, because all that weight you were losing when storm comes back when you get the blood sugar in control. Because now the body's saying, I'm starved blood sugar, I'm going to hold on to it. So now it changed to a couple of classes, and I'm not going to mention two classes. One's called the GLP-1 receptor agonist, and the other one's called inhibitors. So I'll start with the GLP-1 receptor agonist. That is a mimic of the insulin that we create and inject. It is another hormone that we now know is actually even more of a problem in diet. And what it does is it helps your body secrete insulin more, your body not have that polyphagia, not having that hunger feeling. So makes your body not push your blood sugar up in a bed. Those three things are things that we see a lot of companies have made, because we have people losing weight and actually going off a lot of their other medications. And again, it has a lot of effects on this shown to reduce cardiovascular disease and heart attack. We have really powerful stuff. So that's the GLP-1 receptor agonist. Inhibitors also do sort of a similar thing, but in a different way. What's interesting, trying to take a medication that actually essentially doing abnormally, but uses it in a positive way. So we know the body was peeing out as the kidneys couldn't handle it. Well, the SGLT2 inhibitors take that and make the kidney to then lower the sugar into a normal range. And it does that all the while allowing the body to not feel like it's overly hungry. And those group of medications have also been shown in long-term studies to reduce attack and heart failure, which is something else that's in people of color, is to reduce heart failure. Locations that are being studied in so many different areas of healthcare that are really for diabetes and cardiovascular disease.
So great. Thank you, Dr. Carl. What I'm hearing is that for those who have diabetes, there's some new medications out there, right? That you may want to talk to your team about to see if it's potential for you to switch to these medications, because not only are they good for your diabetes, but a lot of them are good to help other things like weight loss and to protect your heart. So new advances in diabetes, and that's why it's important that you have what I call your dream team, right? Because your dream team always wants to make sure that you're getting the best care possible. And like Dr. Carl said, if you can't ask questions, you don't feel comfortable, then you don't have somebody, that person and that doctor is not on your dream team. Bench them and go find somebody else, right?
Absolutely.
All right. Okay, so Dr. Carl, oh yes, go ahead.
My audio, I think I'm also seeing some of the chat, and somebody had mentioned that my audio was sure I'm clear.
Is you're going in and out. So someone's saying you're going in and out. Do you want to switch over to the other?
Well, if it's okay, it might have just been temporary, but
okay, there we go. That's much better. Okay, so there are some questions here. One question is the blood test, the hemoglobin A1C. Does it test for all types of diabetes or only one type or the other? What does that test for in terms of the diabetes?
So what the hemoglobin A1C shows us is that if it's elevated, you're for at least the last 3 months. And so therefore, the definition of diabetes, whether it's type, is an elevated blood sugar. So it will tell us that there's an elevated blood sugar. The issue with it happens so fast that usually the children are wetting the bed room within 24, 48, 72 hours. So you can get a tell you what you already know when you're in the emergency room. It's the hemoglobin A1C, we use it a lot in our individuals with type 2, because they'll walk in the office and say, hey, I might have had some blood sugar problems, 5 years ago, but I'm not sure. And I'll be able to reconcile and say, at least for the last 3 months, this is where I think you've been.
Great. All right. And then at what age should you get tested for diabetes?
So, there's a little bit of varying discussion around. I tend to do, and what the American Diabetes Association tends to say is that, at, your pediatrician age, but in your teenage to early 20s, you're going to be doing your yearly physicals, or at all your physicals, you should have a baseline blood test done. Move into, and a hemoglobin A1C doesn't necessarily have to be done in your 20s. But if you have a family of diabetes, then I'm going to start to move that around at age 30 and hemoglobin A1C. Now, here's the other factor, or the elephant in the room, is practice based off the type of insurance people have. And so sometimes the insurance, I'm not going to authorize that until age 40. And that's always been a constant setting, because sometimes I want to do things the way, if I was sitting in that office and I was talking to myself as a patient, and I know my family, is what I would order on myself. And I'm not doing that to be lavish. I'm doing that because I want to make sure if there's anything, I'm going to identify early, so take the bull by the horns and deal with it.
Okay, great. If you are diabetic and you start having complications like blurry vision or other problems, can that be reversed?
Absolutely, absolutely. So all those conditions can be reversed with the blurry vision. So the blurry vision is an acute issue because of, and typically once the blood sugar is improved, then the blurry vision resolve and or improve. Now, here's the caveat to that. The longer, so let's just say numbness and tingling. I've been having numbness and tingling for then if I've been having it for 8 years. So the more or the longer you've been having, the tougher it's going to be to reverse and or resolve them because your body rode away. So I think it harkens back to what we kind of said earlier. Hey, let's get our physical, our routine physical. Let's also get our family and get their routine physicals, and let's make sure we again attack anything head on early on to have the best possible chance to improve and or resolve.
Great. What do you think about using sugar substitutes instead of sugar, and does that decrease your risk of developing diabetes?
Yeah, so that's a very common question. I'm glad. So here's what's happening. Here's the basic science of it, and that is when you add sugar to your meal, your body there's a couple of things that we kind of a drug. It's one of the most addictive drugs that is known to man. It's just not thought of in that sense. It actually attaches to the receptors in the brain that behaviors that cause us to repeat, whether it be smoking or whatever the case may be, or it makes us continue to want more, have more, and so on and so forth. What it is that refined sugars actually cause the pancreas, and therefore over time the pancreas then has to make more insulin, and that's where insulin. So then the thought process was, what if I trick the body and I use a sugar substitute? Sugar substitute is you get potentially not the calories effect on the brain and the same effect on it causing the pancreas to kind of overextend. Usually sugar substitutes are even more powerful than the bad refined sugars. So not probably, these are not the best. And so with that empty calories, the road to having the pancreas just go nuts, and therefore, blood sugar problems down the road and so on and so forth. So it's the refined, it's not good for the digestive tract. It still attaches to the brain that cause you to have behaviors that are uncontrollable, and therefore I would not recommend sugar substitute. If you can take your food without or additional sugar and use natural sugars, well, before, then you're going to be in a much better place.
So as long as I put regular table sugar on my grits, I'm better than than if I put Splenda or Sweet and Low on my grits. Is that what you're saying?
How about raw brown sugar cane brown sugar, and that's probably going to be. I switched to it many years ago. But think of things like honey, or something else that is from a natural. At least have that sweeter taste, for your meal.
All right, great. Thank you. All right, let's see if there's other questions. Bridget, did I miss any? I think
I saw one that was interesting. what is the recommended? Okay, somebody asked about the recommended kind of blood pressure machine to have at
Okay.
home.
Yes.
And I would say there's no recommendation on the kind of brand. It's just making sure that it has the right cuff size for your arm, and that it also matches the number when your blood pressure is taken the old-fashioned way, and that's with somebody listening to your arm too. Just make it easy for you to use, right size, and matches the right number.
All right. And then our final question, and then I'm going to give you an opportunity to say a final word. But can you reverse diabetes completely? Can you cure diabetes or reverse diabetes? Or once you're diabetic, always a diabetic? Which one is it?
So Donna, you were reading my mind, because I saw that question. And I said, well, if that one, that question. So, here's the thing. I've been able to think about this from a way, and that's purely being trained from the Western side, and then becoming more educated on sort of broadening my scope on different therapies that may be non-Western to maybe help. And so, reverse diabetes, I want to be clear that there is a possibility, if we do some of those things that we talked about, lifestyle changes, movement changes in diet, and those type of things, your body try to improve it and heal itself. Now, that depends on in this condition. So folks that have for some time, we're talking years, then it's very difficult to heal itself. The thing that does not exist, and I want to be very clear here, we can't cure our diabetes. And so what do I mean by that? I came into my office and they just newly diagnosed. They came from the emergency room. We've done a lot of things. We've had people lose weight, change their diet. Okay, being off medication and keeping a lifestyle does not mean diabetes. If I was to snap my finger and put that individual back in their old lifestyle, the blood sugar disease comes back. Well, it never left. We were just controlling it with lifestyle. What I'd like to add is that there's a very easy way to understand and to know where your body is. So therefore, that same example, that individual who, through whatever means necessary, and their blood sugar was, check their blood sugar weekly after that, and they can tell where they are, and so that we can put it on the shelf and then walk out of the room and be something that you can continually monitor and check, but you don't have to necessarily take a medication. I always say your body will tell you what it needs. And so if you're doing lifestyle 5 years and the blood sugar is doing okay, and then all of a sudden you start to see it creeping up, well, then that might be what else needs to happen. So there is not a cure for type 2 diabetes. Gone and done drastic things and help their blood, but it's not cured. It's just it's reversed for the time being, you on some of those active lifestyle changes to keep that going. So just keep your lifestyle, and it's okay if you're pricking your finger once a week or whatever the time may be, blood sugars are and they're doing well, then albeit. I don't want to have to write for me to have additional things being done. I just listen to what your body is telling us. We have a discussion about what to do and how to do it.
Awesome. That is such great information. Dr. Carl, this was such a great conversation and great information. You dropped a whole lot of nuggets. I'm going to try that the raw brown sugar, right? I'm going to try the raw brown sugar versus my refined sugar. So I'm going to give you the opportunity to tell us anything that you may not have already said, or something that you said and you want us to walk away with. So last final tidbits from you.
Well, first of all, I'd just like to thank you for one inviting me here to have this important discussion. But I think there are series of that you mentioned that you're going about you're going about in terms of improving physical health, mental health, spiritual health, and then thinking about how the environment us. And this is Diabetes Awareness Month, and that we also mentioned is Indigenous Month. I started my track in learning in my folks, the African American population, by reading the literature within the indigenous. That's a group of people that really have insulin resistance and diabetes. And so we learned a lot from using a lot of that knowledge and know-how in helping our African American, so our Latinx population, and diabetes in general throughout the world. In terms of what I would just leave this discussion with just something I mentioned earlier. The healthcare practitioner and the patient should be, notice I said that a couple of times, a partnership. And find that individual whom is you're able to connect with, have a discussion about how you want to move forward and work and have. I think that's going to be the best foundation for having ultimately a better outcome. So that's what I would leave the audience. I want to thank your team in the back and all the folks that joined in for listening.
Thank you. Thank you, Dr. Carl, so much. I know you're on, you're 2 hours ahead of us, so I thank you for staying up a little later and to be here on Talking with Dr. Donna. And hopefully you'll come back. But now you are a part of the Generational Health Network. So thank you, thank you, thank you. All right, take care. All right, thank you, Dr. Carl. So just to close out, Talking with Dr. Donna, thank you so much for being here. Just a reminder of our food of the month. Our food of the month this month is persimmons. So if you haven't already tried persimmons, the Fuyu persimmons are the ones that you can eat just like an apple. And now that I'm off my fast, I'm able to eat persimmons, and I have been eating them just like an apple. So sweet, so juicy, so delicious. Again, there's so many different vitamins and minerals that we get out of the persimmon. And if you eat that peel, it's actually considered an anti-diabetic. So you see, this is all coming together. It's an antioxidant and it's high in vitamin C. So that helps with our immune system as we're going into the winter season. We need to really make sure that we are trying to be as healthy and that our immune system is as bolstered as possible. So go, if you haven't tried persimmons yet, it's not too late. There's another week and a half or so of November left. Go get a persimmon, slice it up and put it in your salad. Slice it up and, just eat it raw. They're very good and very delicious. So that's our food of the month. I don't know what Elisita is trying to say to me. Oh, yes, thank you. So just a reminder, next Thursday is Thanksgiving. So there will be no Talking with Dr. Donna next week, but keep your appointment the following week. We'll be back the first week in December with another episode. You can keep your appointment every Thursday at 6:30 p.m. If you have not already subscribed to my YouTube channel, I really appreciate it if you go over to YouTube, hit that subscribe button, and then that notify. So every time we go live, you are aware that we are live. Just some other tips. Again, we had our show a couple weeks ago. We talked about the holiday blues. We know that this is often a difficult time for families, for people going through the holidays. If you're feeling like you're stressed and you're feeling overwhelmed and you're feeling like you want to hurt yourself, please don't. Take the time to just call these 3 numbers, 988, and talk to somebody 24 hours a day, 7 days a week, including holidays. There's someone there who can talk to you and hopefully help you to recognize that you are valuable and that you are loved, and not to do something to harm yourself. Again, we're all moving into our respiratory season. We know RSV is out there. We talked about that last week. Flu is out there, and COVID is still out there. And one of the ways that you can protect yourself from all 3 is by wearing your mask. So while you're out in public and you're in large settings, I highly recommend that you continue to wear your mask. Try to limit your groups that you're going to be with, and of course, continue to wash your hands. Protecting yourself and your others is going to be so important. If you haven't already gotten your bivalent booster, this is the time to get your booster shots. Get it in. If you haven't gotten your flu shot, get your flu shot. Get it in before the winter season hits. And tonight, I want to particularly encourage you, if you heard something that was enlightening to you, something new, please amplify the message. Let somebody else know. Tell someone about making sure that they have a partner in their healthcare provider, not just someone who will talk to them and tell them what to do, but who will partner with them in their care. Remember, got to have a dream team. Again, follow me on all these channels. Hopefully you all will have a very, very blessed and thankful Thanksgiving. I know I'm looking forward to my family coming into town as I host Thanksgiving. It's just a wonderful time of year to be grateful and to gather together. But if you do, think about wearing a mask. Think about testing for your COVID kits. If you need some kits, let Dr. Donna know. We have some. All right. Thank you again for keeping your appointment tonight, and I will see you in 2 weeks. Until then, take care. On Talking with Dr. Donna, we focus on 4 pillars of health to help build a generational health network to end the cycle of premature death in the Black community. I created Talking with Dr. Donna as a way to educate as many people as possible and give accurate information from a trusted physician. Go to Talking with Dr. Donna and get accurate information. And then share that information with your family and friends. And if you like what you see, like my channel and subscribe. Remember, every Thursday,